The Reichel Chun multi-purpose titanium forceps have recently been developed and are available from Epsilon. These forceps were designed to provide the vitreoretinal surgeon with a single tool for the extraocular manipulations that are necessary for the placement and removal of the trocars needed for small-gauge, sutureless pars plana vitrectomy surgery. The Reichel Chun forceps have a bevel grasping platform that is 3.5 millimeters in length. When the tip of the instrument is included, the distance is 4.0 millimeters. The forceps allow for the atraumatic manipulation of the conjunctiva, measurement of the distance from the limbus, and provide for a strong purchase of the trocar for both its fixation and removal. The surgeon measures the distance from the limbus to locate the site of insertion through the pars plana. In phakic eyes, the incisions are made 4 millimeters posterior, and in aphakic or pseudophakic eyes, the incision is made 3.5 millimeters posterior to the limbus. In this phakic eye, the measurement is being made 4 millimeters from the limbus. The teeth of the forceps were designed to gently manipulate the conjunctiva so that tissue is not torn or macerated. Here the forceps are used to grasp the conjunctiva atraumatically as the inserting blade crosses the sclera. The forceps are now being shown, stabilizing the eye while the inserting blade enters the vitreous. The bevel of the forceps is shown conforming to the grasping end of the trocar, therefore easing the removal of the inserting blade. The strong purchase of the forceps to the grasping end of the trocar allows for a minimal amount of twisting, if any, that may be necessary to remove the trocar. This is optimal for reducing the possibility of deforming the wound that could ultimately result in a leak. The back end of the forceps can also be used to compress the wound after removal of the trocar. The use of a single instrument that is atraumatic to the conjunctiva can measure the appropriate distance from the limbus and stabilizes the insertion and removal of the trocars, can improve both surgical technique and outcome.